Hey everybody, this is Robert and welcome to Outbreak News TV. And in today's video, I want to go ahead and take a look at some newer research, some things that are going on as we continue to try to unravel the unknowns about the SARS coronavirus 2, the cause of COVID-19. And we'll start out with this article, which talks about a study that says COVID-19 is at least 10 times deadlier than the typical flu. 10 times more pathogenic, more deadlier than seasonal flu. So it says here coronavirus disease 19 or COVID-19 causes at least 10 times more deaths than typical seasonal influenza, according to an analysis in the journal JAMA Internal Medicine. And they use statistics from worldometer.info to make their case. The researchers noted that the disease caused by the new coronavirus, SARS coronavirus 2, caused 15,455 deaths across the U.S. during the week ending April 21st. And the week prior to that, it was about 1,000 less. Conversely, during a typical week during the winter season, the flu causes 350 to 1,600 American deaths, based on a review of figures from the U.S. CDC that cover the period of 2015 to 2018. So the stark difference in the impact of the two viruses should alert Americans to the seriousness of COVID-19 and help shape public health response to the ongoing pandemic, according to experts. But Kevin Harrod, he's an infectious disease specialist at the University of Alabama at Birmingham, said, quote, "Unfortunately, differentiating between 0.1%, the death rate for the flu, and 1%, the death rate for COVID-19, means little to the general public. But when you say that 100,000 people will die from the flu compared to 1 million people who will die from COVID-19, then people will start to take notice." And of course, those are just arbitrary numbers that he threw up there to show you the 10 times difference. As many as 50,000 people in the U.S. die from the flu annually, according to the CDC. About 35 million Americans suffered from the flu this past winter. Fewer than 30,000 died. Only a fraction of the cases of seasonal influenza are confirmed by laboratory analysis. So, of course, this means these are all estimates. To compare the latest figures from Johns Hopkins, a couple days ago, there was about 1.4 million Americans infected with COVID-19 and about 86,000 that died. Public health officials continue to liken the impact, public officials, politicians and the like, continue to liken the impact of COVID-19 with that of flu. But I guess the main message out of this study is that there is a big difference concerning the death rates, 0.1% versus 1%, 10 times more. For the week ending April 21st, researchers calculated that COVID deaths for the week were 9.5-fold to 44.1-fold higher than the peak week of counted influenza deaths over the past 7 winter seasons. So there is clearly a difference. It does appear, as we continue to learn about this coronavirus, that it is more lethal, it is more transmissible, and it can cause quite a bit of pathology in the individual. And there are some distinct differences between the influenza virus, the seasonal type, versus COVID-19, the SARS coronavirus 2. So anyway, I just wanted to share that with you. And of course, that was from the journal JAMA Internal Medicine. Something else that's really important as we continue to learn about the COVID-19 or the SARS coronavirus 2 is, how much immunity does an infection confer? We just don't know. But fortunately, there are some people taking a look at this stuff, and they were looking at it before we even knew about SARS coronavirus 2. And these are from researchers at Columbia University. And the title of this article is "What if immunity to COVID-19 doesn't last?" And it says, researchers at Columbia actually started this about 4 years ago. And they were collecting nasal swabs from children and teachers and emergency workers and anybody that was producing sneezes or sore throats or any kind of cold-like symptoms. And what they were trying to do is make a map of common respiratory viruses and their symptoms and how long people who recovered, stayed immune to each one. Now, prior to SARS coronavirus 2, I would say the average individual probably never heard much about coronaviruses, but there are circulating every year 4 common coronaviruses that cause the common cold. And they're listed here as HKU1, NL63, OC42, and C229E. Don't hear much about them. They cause a cold. Billion plus people get the cold in the U.S. every day or every year. But now we have this new coronavirus and we have the world in lockdown. So we're looking at this study to see, can we extrapolate in some way that the SARS coronavirus 2 in its how it confers immunity, how does it compare to the other coronaviruses? I mean, it's not a direct analysis, but yeah, we can at least take a look at it, right? So what the Columbia researchers described in their report is some cause for concern. They found that people frequently got reinfected with the same coronavirus even in the same year, and sometimes more than once. Over a year and a half, a dozen of the volunteers tested positive 2 or 3 times for the same virus. In one case, with just 4 weeks between the positive results. Now, this compares quite differently from some, the immunity conferred by some viral infections, like, measles, lifelong immunity, chickenpox, lifelong immunity. But according to Jeffrey Shaman, he's with Columbia University, he says, for coronaviruses, immunity seems to wane quickly. Now, so whether COVID-19 will follow the same pattern is still unknown, right? And this is what this video is about. There's a lot of unknowns. But this research does suggest, some of this public discussion about the pandemic could be misleading. There's talk about getting past the peak and immunity passports and that kind of stuff. But at the same time, some hope the infection is more widespread than generally known, and that only a terrible death total stands between us and high enough levels of population immunity for the virus to stop spreading. But this all boils down to is the immunity long-lived, or is it fleeting? We don't know. I think they did a study after this SARS epidemic back in 2003, and they came up at the time somewhere in the ballpark of 2 to 3 years of immunity. But with these coronaviruses, apparently not so much. Does that extrapolate to SARS coronavirus 2? Don't know. We don't know. But they are very related viruses, right? Quote, what I've been telling everyone, and no one believes me, but it's true. If we get coronavirus every winter, even though we're seroconverted, that is, even though most people have previously developed antibodies to them, they get the viruses again. According to Matthew Freeman, he studies coronaviruses at the University of Maryland. Quote, we really don't understand whether it is a change in the virus over time or antibodies that don't protect from infection, he said. So that's some pretty important stuff. Because a lot of people are relying on these antibody tests to determine, right, do I have immunity against the virus? Can we really start getting back to the true normal? If you're positive for the antibody, are you immune and you won't get sick again? Lots of unknowns. We really don't know. So that's an interesting piece from the MIT Technology Review. Another thing that's been highlighted recently, and I've highlighted this several times on the website outbreaknewstoday.com, is animals and the transmission from people to animals or vice versa of the SARS coronavirus 2. And I've reported in the past on cases of cats and dogs in Hong Kong, cats in New York City, and of course the big cats at the Bronx Zoo. And you can check all that out at the website. But in this Nature article titled, "Dogs Caught Coronavirus from Their Owners, Genetic Analysis Suggests," then it's subtitled, "But there's no evidence that dogs can pass the virus to people." So let's take a look at this real quick. The first 2 dogs reported to have coronavirus probably caught the infection from their owners, say researchers who studied the animals and members of the infected households in Hong Kong. An analysis of viral genetic sequences from the dogs showed them to be identical to those in the infected people. Researchers suspected that the infection had been passed from the owners to the dogs, and the direct genomic link strongly supports that, says Malik Paris, a virologist at the University of Hong Kong who led the study. The study showed no evidence that dogs can pass the infection to other dogs or people, but it is impossible to be certain in which direction the virus traveled, so we have to keep an open mind, Paris said. Although the analysis confirms that people with COVID-19 can infect dogs, the probability of this happening is low, says Arjane Stegeman, a veterinarian epidemiologist at Utrecht University in the Netherlands. In the study of only 2 of the 15 dogs who lived with infected people caught the disease. But other scientists say the possibility that pets might spread the virus between each other and to people needs to be properly investigated as part of managing future outbreaks. So, anyway, so it talks more about animals, different dogs and cats, and protecting the pets from the virus and being able to test the animals that have close contact with people. So it's very interesting stuff. And that, again, of course, is from Nature. And again, let's talk about another topic that we talked about during Ebola. We talked about it during Zika. We recently talked about it on this YouTube channel about sexually transmitted dengue. So, can coronavirus be sexually transmitted? Because it's been found in semen. And this is from a Healthline report. And they say, as the weeks fighting COVID-19 wear on, there's so much that researchers and medical community are learning about the coronavirus on a daily basis. Most recently, researchers in China have discovered traces of SARS coronavirus 2 in the semen of several patients with COVID-19 and those who recovered, suggesting that COVID-19 might be able to be sexually transmitted. With any viral infection, it replicates, circulates, and gets into a lot of tissue. It's not surprising that they're finding SARS coronavirus 2 in multiple different bodily tissues and fluids, according to Dr. Matthew Hines, a hospitalist at Tucson Medical Center. The study says that they looked at 38 participants who provided semen specimens. 23 of these patients had achieved clinical recovery, and 15 patients were at the acute stage of infection. The results of the semen testing found that only 6 patients, about 16% of them, had positive results for SARS coronavirus, the new coronavirus. The 6 were composed of 4 from the 15 in the acute stage and 2 from the 23 that recovered. There was no significant difference between age, urogenital disease history, days since onset, days since hospitalization, or days since clinical recovery. So, is COVID-19 sexually transmitted? That's the big question. And it's been confirmed that COVID-19 is transmitted human to human through respiratory droplets and contact. Earlier studies in China didn't find traces of the virus in semen of men who tested positive, meaning the conclusions of the most recent study contradict the previous ones. So it's important to understand that while the virus is found in a small sample size of semen in this particular study, this does not necessarily mean that the virus itself is transmitted sexually. I am shocked by this, said Dr. Jill Grimes, board-certified family physician and author of The Ultimate College Student Health Handbook. However, she added, we don't know yet if detectable COVID viral particles in semen are infectious. The study doesn't establish that sexual transmission occurred, she said, but confirming the presence of the virus in semen does make it something that needs to be researched and verified. So there we go. As we continue to try to learn more about this virus and the disease processes and zoonotic transmission, things are coming out every day, and it's very important to keep on looking at this stuff because that's the key with COVID-19 right now. If I was to use one word to describe what things are going on, is unknown. So people are digging, trying to learn, and yes, we all appreciate the work that's being done on that. All right. Well, let me know what you think. Comment below, subscribe to the channel, share it with your friends, and I'll see you next time on Outbreak News TV.